come in for surgery for maybe some abdominal surgery as well. So sort of how you go about preparing for surgery. I know a lot of people will always ask questions on what can we do after surgery, so a little bit about that, and I'm going to touch on the complications after breast surgery, particular cording. It's quite simple. It's not going into great detail about anything in the presentation, but if you've got any extra questions at the end, then we'll have a chat. Firstly, just preparing for surgery. So this has kind of been, we've written this kind of if you're coming in for maybe it's like a gynae cancer or something, but anytime you're coming in for any sort of surgery, it is important to prepare well. And if you prepare well for your operation and you understand what what's going to be happening, then generally you'll recover much better. We've started recently at the QE, we've running a new program called the I Breathe program for anyone who's coming in for gynae oncology surgery. I put a little YouTube link on there. I think hopefully it'll work, but if you wanted to look back at it, I would encourage you to have a little look at that, because that's looking at the sort of breathing exercises you do, how you can prepare well. It touches on exercise. So we said that the chief medical officer would recommend 30 minutes of exercise for anybody in the public. So we're saying if that's what you should do is in the public, we should be doing that more for you should definitely be doing it when you're coming in for surgery. So it's just all a bit, so I would encourage you to go and have a look at that YouTube link and have a listen to me talking a bit more in detail about how you prepare well for your operation. So then after surgery, a lot of people think, well, what are we allowed to do? Are we allowed to lift this? Are we allowed to carry that? What exercises can I do? So I can't sort of tell you all without knowing everybody, what everyone, we can't give an individual exercise program out without a full assessment, but we can give you some basic advice about how to look after yourself. And if we're thinking about if you come in for an operation on your tummy, generally it's a sort of a 0 to 12 week period of recovery, with 6 weeks being the time when you can start getting to do a few more things. And anytime anybody asks what's the best thing I can do to help recover from surgery, and I would even say this to people who've had breast surgery, just for your own health and well-being, just walk is really the best, that is the best thing you can do, because a lot of people get worried about how can I recover well, and it's not rocket science. It's just looking after yourself and being healthy like you would normally. But from if I go on the next slide, I think I've got a little, I hope you can see that. It's something where you did actually used to give out on the wards, and it's a little guide. It's got a lot of different things on there. So it talks about making a drink, driving, housework, lifting toddlers. So lots of different things that you might think, when am I allowed to start doing this? And if you look down, most of the things, it's pretty much no until week 6. And when you get to week 6, you can start gradually building yourself up to doing things, with the aim of by sort of week 6. The only thing that we don't say kind of no to is the walking. If you can see, walking starts from day 1, and people, when they're coming for their surgery, we have them out of bed pretty much as straight away as we can. But gentle walking is what you can do for straight away. And then what we say as a guide is by about the end of week 6, you should be able to comfortably walk for 45 minutes if that's something that you could kind of do beforehand. So that might be useful to some people. Obviously, some people are different depending on what you were able to do before your operation will depend on what you can do afterwards. We would only really expect people to get back to what they could do before, but hopefully that might be quite useful. And then there's also some little people often ask, what can we do? Any little exercises? What can we do? So again, this is more appropriate for people who've had abdominal surgery, but little exercises like pelvic tilting and starting just to get your abdominal muscles engaged again is quite useful. Just lying on your back and just tucking your tummy muscles in, knee rolling again, trying to tighten those tummy muscles in and get your knees rolled from side to side. And abdominal curls is something probably I would take with a little bit extra caution. It makes sure you haven't got any back problems or neck problems, and not doing full sit-ups or anything. But if you're normally pretty fit, you went to the gym, you exercised quite a lot and you wanted to get back to that, it's the sort of things you could start to do if everything was healing nicely. But these pelvic tilt and knee rolls are always little things you can do at the start. So just we've got number 6. Yeah, so walking by the end of week 6, you should be able to comfortably walk really for 45 minutes if that was something you could do before your operation. Swimming's another good one to get started with when you want to maybe become a bit more active during your treatment. I think the only thing we would say is if you have any sort of immunocompromisation with chemo or anything like that, would probably not be something we would advise you to do for swimming, and you would need to make sure that your wound's healed. But that's a really sort of simple, gentle exercise to get back to. And then again, when you're recovering from any sort of operation, you know, I think a lot of people, even if you've had breast surgery, it's a major operation for yourself, but in terms of invasive surgery, you know, you're still going to feel quite tired from it. And it's same as when you've had, you know, abdominal surgery. So don't expect too much too soon, and don't worry if you're feeling tired all the time, or if you know, it's taking a bit like, give yourself some time to recover from it, because it's quite a big thing. And just give yourself little small goals. So it could be like, I'm just going to walk to the end of the street today, or tomorrow I'm going to get a couple of extra lampposts in. You know, I'm going to go up and down the stairs a few more times. Just try not to think too far ahead, particularly. And I think it's more hard if you used to be very active and you used to maybe go to the gym and stuff. I think you think 12 weeks is a long time to wait. But you have to listen to your body. And sometimes you might feel all right on the outside, but we do have to let things all heal up in the inside. So it is important that you don't do too much too soon. I'm trying, Caroline, to get, how do I get, oh yeah, sorry, I couldn't get into the next one. So that's just the little things about surgery. So we can't obviously give you a specific exercise program, but just some sort of little hints and pointers that I think would be probably quite useful for whatever type of surgery you had. And I'm just taught, because I also work in the Gynae-Oncology Lymphedema clinic. We do have a clinic here for those patients, and it's just to give you a little bit of a heads up. If you were coming in for surgery, for gynae-oncology surgery, you know, lymphedema is a risk of that treatment, particularly if you have your groin nodes taken away, plus or minus some radiotherapy treatment. And a lot of people get quite worried that they've got lymphedema straight away, because your ankles do swell up when you come in for an operation. So we'd always say, don't worry too much those first 6 weeks. But after 6 weeks, if your ankles are maybe still quite swollen, it's probably worth getting investigated for it. And also you can get, so if you had a lot of surgery done at your groin nodes, and maybe sometimes you get an infection in your groin wound, or you get something called a lymphocyst, which is a little bit like a blister where you've had that surgery. If you do have those sort of problems after an operation, sometimes you would be at greater risk of developing lymphedema. So it's always not a bad idea just to be, part of managing lymphedema is actually looking out for the early signs of it and dealing with it early. So in your legs, socks or your shoes feeling tight, maybe feeling there's some fluid under your skin and you're leaving your fingerprints in when you touch your leg. And then just to say, get advice early. Speak to your gynaecology nurse or your doctor, and we can get you into the clinic here where you get some more specific individualized exercises, and we look at compression garments. But I think the next presentation will probably go into lymphedema a little bit more. So I'll move on to breast surgery. So I think a lot of you guys have had breast surgery or going to have breast surgery. So it does have an effect on your arm and your shoulder movement, and there is a risk of that. And the more extensive your surgery is, the greater the risk of that probably. If you've had previous shoulder problems, again, there's probably more risk of you developing problems after your operation. But it is important to get your arm moving as soon as possible. Anytime, even if, I work in critical care, so we have people in bed for a long time on there, and any form of being in bed for any strength of time, or just not moving in your normal movement pattern, is going to affect your muscles and your range of movement. So the exercises that you get given, either on the ward or that you get in the information booklets, you really need to get in a routine with those early. And it's kind of like, I always kind of say, it's a little bit like brushing your teeth. Make sure that becomes part of a routine, of just a new routine that you do when everything's healing up nicely. We do get, we don't often see you when you come in for your surgery if you have daycare surgery, but we are here if there's any queries. But if you do come in and you sit on the wards and you have an overnight stay, you will see a physio who will give you a leaflet with some exercises in. Next one. And yes, the exercises. So if you imagine when everything starts healing up, you get scars. And what we want you to do is, we don't want you to get a tight scar where you've had any of your surgery. So the idea of the exercise is that you'll just get a nice flexible scar when the wound's healing, so nothing gets tight, obviously. And that's the aim of doing the exercises regularly. And cording, that I'll talk about in a couple of minutes, is I think a problem that a lot of people get worried about. And again, doing the exercises early, getting the routine, tries to reduce the scars that might develop from that. If you do have problems long term with your arm and your shoulder before you came in, and you start doing a few little simple exercises with it, it might help improve those symptoms, and it also may reduce the risk of developing lymphedema. So there's lots of reasons why you should do your exercises. And cording, so it's also called axillary web syndrome, and it's used that because you often find, if any of you have got cording, you'll find that it feels like a sort of tight web under your arm, and it can run down your arm. So it starts in your armpit, and it's common to sort of feel like a tightness in the arm, and it goes down your arm. And sometimes you can see visible cords that are going down your arm, and basically that's the thickening of the lymph vessels. That's what it is. So often the more lymph node surgery you've had, so if you've just had a little biopsy, your risk of developing cording isn't as great as if you've had like a full node clearance. So the more surgery you have, the greater the risk. It doesn't mean it's going to develop, but you'd be more worried about it developing. Therefore, we should try and do the exercises as regularly as we can. But unfortunately, we can't stop these things happening all the time, but that's what we would advise you to do. And it usually, if you're going to get cording, it normally occurs quite short term after your operation. There is cases of it happening a bit further down the line, but often if things are happening a bit further down the line, it might be another musculoskeletal problem rather than something directly related to the lymph nodes being removed. So yeah, signs and symptoms, I think I might have already touched on, but yeah, tightness in your armpit, running down your arm past your elbow. Sometimes you can't straighten your elbow out, so it's really tight on the front of your arm, and you can't lift your arm up above your head and fully straighten your arm. But yeah, often you can see those visible cords running down, and sometimes it goes across into your chest as well. It's not always down your arm, it can come across into your chest muscles, and that can feel quite tight. And then what we would do, as well as doing your exercises that you should do from your operation, we would get you to do a few more specific stretching exercises. So a lot of the exercises you get from your operation are more on the range of movement. They're quite simple, like up and down, out to the side, all that sort of simple stuff. But when we have cording, we really want to sort of stretch those cords out a little bit more. So we would advise that you come and see one of us as an outpatient, one of the best, sort of myself or my colleague Dawn, to have a bit more advice on cording. It's really important to have pain, to keep your pain under control. I know a lot of people don't like taking pain relief, but if we want you to exercise after your surgery, or if you've got cording, make sure you take your pain relief, because if you take your pain relief, you're going to do your exercises and then it'll recover. If you don't take your pain relief, then you probably won't do the exercises as well, and then you'll get problems with the problems that we have when we don't move our arms properly. Again, things like swimming, getting in the water are always quite good things if you've got no problems with your wounds. And as I said, you might want it. It might be worth you coming to see one of the physios face to face. So that's just a bit of an overview, some sort of simple stuff that I've just sort of told you about. I would also say, if you have any problems or questions related to surgery or what you can do, we are available. So I sort of head up the surgery team, but there's a few different, if I'm not around, there's a few of us here who work on the wards. So there's a contact number on there, and you can always ring that for the ring the phys that gets you through physio reception. You could leave a message for for some phone call advice. That would not be a problem. And then the other thing I would say is just sometimes you do get musculoskeletal problems. I mean, sometimes after your radiotherapy is another thing that can cause problems with your arm. And then sometimes if you come and see me and I don't think it's cording, or I think it's not specific related to your actual surgery, it's sometimes more appropriate to go and see an actual musculoskeletal physio, and we would probably direct you to the Tyneside Integrated Musculoskeletal Service or Sunderland one, depending on where you're from, which is through your GP. It's not because we can't see you here, it's just that if you think you're getting a frozen shoulder or anything like that, you're probably best off seeing someone who's an expert in that rather than who's an expert in sort of the cordon side of things. So but yeah, and your GP can do those referrals. And that was it really, Caroline.
That's great, Ruth. Ruth, I'd asked some of the patients to put some questions through.
Yeah.
prior to today's discussion. One of those was neuropathy after chemotherapy.
Chemo. Yeah.
Is there any sort of specific exercises you could recommend for neuropathy of the hands and feet?
So is that the kind of they're losing their feeling in the hands and the feet,
Yeah.
struggling with the balance? Yeah. It's one of those tricky ones because we never know that with when you start getting nerve problems, we can never kind of say exactly how things are gonna heal and when the time, and it's a lot of like what we call like proprioception type stuff, which might be again, it would probably be warrant someone actually coming and seeing us really, or seeing a physio, pointing in the direction of a physio. But things like balance exercises, again, walking, like touching your skin. I don't know if you want to come in with anything that you have experienced that in palliative care, Dawn. I'm just asking Dawn if she wants to jump in with anything, stuff like that. But that we do often see that. And now actually people who have chemotherapy often come in with cordon. So they'll actually have, I probably should say, actually you have nothing wrong with the breast surgery, but you actually have cordon into the vein that give you the chemo. It's I have had a couple of people that then have cordon in their arms again, but so yeah, I don't know if that's helpful or not.
So with the cordon, would you massage that site as well?
Sometimes you can massage. Yeah, sometimes you can massage it. Massage and stretches really are the key things that you can do. And sometimes it'll just give. Sometimes it will actually just. Sometimes people say, "Oh, you just hear a bit of a pop, a bit of a just a give, and it just give."
We hear that noise, don't they?
Yeah, but it's true. I have a couple of times. I have had a patient who literally couldn't bend that straighten their arm out, and with lots and lots of repetitive stretching, it just all of a sudden they could straighten their arm out. So everyone's different, but yeah.
In a lot of the questions I get as well is after surgery, maybe going back to things like a gym or going back to the a class that would normally do something after like breast surgery. At what point do you think it's generally safe to get into some sort of light exercise?
I think with breast surgery, I would say anything after sort of 6 weeks. And if your movement's back to normal and your wounds, if your wound's fine and your movement's back to normal, I think probably I wouldn't want to do anything earlier than that, other than 6 weeks. And then again, it's all about when you start doing it. So say you started doing something at 6 weeks, you're not expected to be doing it fully. You've got to sort of pace yourself up, get yourself up to the full, you're not going to be able to go straight in exactly what you could do before. Again, it's like gently building yourself up and being sensible and say, all right, I'm just going to do a small amount this time and then build it back up again, rather than going full blown in straight away is important as well.
And obviously you're going to get some discomfort as well. And I think one of the things I've always counseled patients is that, expect the discomfort. Discomfort isn't something we should worry about. Obviously extreme pain or become really painful. But I suppose any kind of, when you're trying to progress your fitness back again, you're gonna come across some discomfort.
Yeah. Dawn, do you want to say something?
Yeah, in relation to sort of gym classes, things like that, it might be worthwhile if somebody is involved with a leisure centre, there might be somebody that can give them an induction and a specific exercise programme as well.
Yeah, I think a lot of people after breast surgery in particular, like lifting weights and things like that, they kind of avoid doing it at all costs. But and I know the lymphedema nurses will touch upon that, about actually weight resistant exercises can be really beneficial.
Yeah, it's just been, I think it's just been mindful not to do anything all at once and all of a sudden after not doing anything. For even if you had been like you're starting to take up a new exercise, even if I hadn't been for a run for 6 weeks, I'm not going to go, and I used to be able to run 5Ks, I'm not going to be able to start doing that straight away again. It's just
building from the bottom, and
you should, your body does have aches and pains for reasons, and nothing should be causing you too much pain, and if anything causes you pain, that's you're doing too much too soon.
Yeah, that's great, thank you very much for that. I'm gonna, hopefully once the recording and the presentations are finished with the lymphedema nurses, I will give everyone an opportunity to ask their own individual questions. But I'm just going to move on to the next presentation with the lymphedema girls.
Right, are you all right if I just take control of that, Caroline? Yeah.
Yeah.
Lovely. So my name is Neely, and this is Rachel. We are both breast care nurse specialists here at the QA, and we also run the lymphedema service within the breast unit. So our specialty does tend to be more, upper body. We tend to cover lymphedema in the breast, the chest, and down the arms. But a lot of what we're talking about today will be applicable to lymphedema in the other areas. All I would say is that if you are concerned at any point about lymphedema, it's important that you get in touch with your relevant specialist, and they can refer you on to whoever they feel is appropriate. Obviously, we have our service here. We also have the service for the lower limbs, but I know places like St Oswald's and St Benedict's also have lymphedema services, particularly for those who have got quite severe lymphedema. It's always kind of our hope that we will catch it quite early on, and so that you don't kind of get to that point. And really, our presentation today is kind of just to give you an idea of the signs and symptoms to look out for, so that we can kind of get you on treatment as early as possible, so that we never get to that point where it's at severe lymphedema. So let's see. So what is lymphedema? Effectively, it's a chronic swelling that develops because of an impairment to the lymphatic system. Most people have what we call secondary lymphedema, where it is caused by another issue that they have going on. More often than not, it tends to be as a result of cancer or because of the treatment that people have had because of cancer. So I've got this little picture here, and basically we've got two systems within our body that move fluid around it. One is your circulation, and obviously that's got your heart to kind of pump the blood around your body, and then you've got your lymphatic system, and that effectively doesn't have a pump to kind of move the fluid around the body, completely relies on muscle movement. So I know Ruth had touched on earlier the fact of how important exercise is in terms of reducing your risk of lymphedema, and the reason for that is because it solely relies on muscle movement. So every time your muscles relax and contract, all that fluid is just slowly being pushed back up and into the lymph nodes. Oh, I keep lifting the wrong mouse. So what signs should you look out for? The earliest signs tend not to really be swelling per se. People would often describe it as a discomfort or an ache. They might feel a heaviness in your arm, your breast, or like a tightness. People will think that actually it feels better if I can get like a good massage in that area. People will say if I can get like a really good like heavy massage, then it kind of gives them a little bit of relief to that area. And you might also feel that your clothes or your watch might start to feel a little bit tight. If people have got it in their hands, and they tend to find that they haven't got quite the same strength of grip, they maybe can't bend their fingers the same way that they could, or like they can feel the tightness when they're making a fist with their hand. In terms of later signs, then that is once you get to the point where you're seeing visible swelling in your affected area, then we would call that quite late signs, and we want to get you before that happens, because the earlier the treatment starts, the easier it is to manage. The thing with lymphedema is once you've got it, it is a chronic condition that you can never get rid of, but we absolutely can manage it. I've popped this picture on here. This picture, it's actually a picture of somebody's thigh, but it's very, we see this type of dimpling quite a lot in people's breasts after they've had breast surgery. And so it's important for you just to kind of keep an eye out for that. You can also get like a tightness or a hardness on the skin, and you can be more prone to getting infections on the skin. So either in your breast, your arm, anywhere that's affected by the lymphedema. I've lost what I was going to say. In terms of reasons why you would be affected, particularly with people who have had breast surgery, it tends to be when you've had lymph nodes taken out. So we tend to find if you've had multiple lymph nodes taken out, so kind of more than 5 kind of upwards, then you are more prone to getting lymphedema in your arm and your hand. If you've had what we call a sentinel lymph node biopsy, where you've only had maybe 1, 2, 3, or 4 lymph nodes taken out, then we're finding that those people do tend to be more prone to getting lymphedema on the breast. So if anyone has got this, I mean, you might already look at that and say, actually, I have got a little bit of that area, in my breast. Maybe go and have a look in the mirror and see what you can see around there, because actually it's really, really easy to treat, and we can get rid of that quite quickly for you. So in terms of treatments, we've got a few things here to kind of show you what we do in terms of treatment. So the first thing we would say is skincare. It's really, really important to keep that area moisturized. The reason for that is because your lymphatic system is actually what helps your body to heal. And your lymphatic system carries lots of proteins, nutrients, white blood cells, so it helps fight infection. So if your skin's very dry and you happen to get a little cut on it, which you're obviously more prone to if it's very dry, if the lymphatic fluid can't get out of your arm, then it's going to start raising infection, because the white blood cells that normally go there fight the infection and come away again. They're not able to get away. So for that reason, we say skincare is really, really important. Keep that area nice and moisturized. We would normally recommend that you just lather it with moisturizer before you go to bed. Give it a long time to kind of soak in. The other thing would be exercise, like we've already talked about. So certainly for us, we say exercises. It's really just stretches. It's nothing, too laborious by any stretch. We kind of talk about people you start off with your neck and you go round and round, backwards and forwards, same with your shoulders, and then you're moving down to your arms and then your hands, basically, is what we would suggest. In terms of your legs, again, it's just moving your ankles around, bending, stretching, that kind of thing with your legs. Stuff really that you would often do, if you're on like a long haul flight, where they tell you to kind of keep your ankles and that moving. I know Caroline touched on earlier as well. I think it's often people think if they've got lymphedema that they shouldn't use that affected area. So we often find people who have got a swollen arm and they'll say, but I don't use that arm because I know that it's got this and I want to kind of I want to protect it. I don't want to make it any worse. But actually we know that by not using it, you could potentially make it worse. So it's important that you are using that arm. There's a lot of research now that says that that you absolutely can, with lymphedema, you can go and do resistance training. You have to do it probably a bit slower than most other people, and certainly your graduation up to heavier weights has to be much slower. But actually, it's been found to be safe and effective, and it can help reduce your lymphedema. The other thing that's really good for that in terms of exercise is swimming. The reason being that the action of the water going over the skin actually massages the fluid back up towards the body as you're kind of doing your swimming action. One of the other things that we've got is Mobiderm. So I don't know if anyone's actually heard about this, but I don't know if you can. I'll kind of show you this little. It's like a little knobbly kind of piece of fabric, and this is actually really good for people who have got, you can put it anywhere really, but we often give it to people who've got lymphedema in their breast, and you just pop it in between your bra and your skin, and it just sits against the breast like that. And then as you're kind of walking about, you're doing your day-to-day thing, it sort of gently massages that area, and that gentle action of massage helps to kind of move the fluid back out of the breast. And it can take a good 2 to 3 months for that to work. So we often give people one to wear, one to wash. And if you need any fresh ones, we can just post them straight out to you. But again, if anyone's noticed that dimpling that was on the last slide, just phone your breast care nurse and let them know, and we can get you some of that posted out. We've had really, really good outcomes from that, and it's really, really effective at what it does. I've mentioned here as well about gentle massage. So there's a type of massage that we do called simple lymphatic drainage, which is a very specific way of massaging around your body and around your affected area to kind of move the fluid basically in the right direction. It has to be done a certain way, so we tend to say that you have to be guided by a trained professional. Myself and Rachel are actually in the process of doing a video that we're going to put on the website, and obviously we'll be able to email out to people to kind of guide them through how to perform the SLD on themselves. So again, if anyone's got lymphedema, or if you're interested in hearing a little bit more about that, please feel free to get in touch with us. It's not something that we've offered an awful lot to in the past, but certainly something that we're quite keen to do for people moving forward. We've then got compression sleeves, which I think is probably the thing that most people would associate with having lymphedema. You'll see people who have got these sleeves on. I don't know if you can, I don't know. Oh, there we go. So it's obviously got, some of them have a hand, some of them don't. And they often have like a grip top. So this kind of sticks to the skin a little bit and just keeps it up. And that basically compresses the skin slightly. by varying degrees, and that kind of helps as you're kind of walking around doing your day-to-day business. That kind of helps the fluid move up the arm. I think Rachel's going to try and get it on for you.
Try and put that on.
Demonstration.
I mean, then relative something to put on, folding it halfway down, slipping it onto the affected arm, and then just easing that up so that you get no creases in it. And then when you've got it all the way at the top, then obviously you've got your grip at the top of the sleeve, which when you flip that round prevents it from falling down when you're wearing it and doing your day-to-day activities. And you know, when it's the correct size for you, it's relatively comfortable to wear, and often patients will say to us that, you know, they feel much better by having that on.
Yeah, so I think for a lot of people, having to wear a sleeve can be a daunting thing, because it's a very visible thing that people can see, you know, relating to the, you know, to the diagnosis that they've had, and so that can be traumatic sometimes for people.
Yeah.
But actually, a lot of people that we find who come in with that heaviness, that tightness, they put the sleeve on and they get a lot of relief from it. And they will find if they go for, you know, a few days of not wearing their sleeve, they'll say, my arm's back, it's aching again, you know. And so we would always recommend with the sleeve that you wear it, you know, pretty much from the minute you get up until the minute you go to bed. If you are doing any exercises, that you wear your sleeve while you're doing your exercises. And if you are moisturizing, we tend to say let the moisturizer, you know, fully absorb into the skin before you put your sleeve on, because you'll just have a bit of a nightmare getting it on realistically. Don't wear it to bed in case it falls down, crumples, and you'll end up with, you know, little marks on your arms. Just wear it during the day generally.
And just obviously when you've been fitted with a sleeve, we say to build up wearing it, don't we? So recommendation is for the full day, but you know, start off just with a couple of hours and then ease up from there. Yeah.
And then for those who have got more severe lymphedema, then you can have compression bandaging, and you might have seen this is basically where they do 2 or 3 layers of a type of bandaging, either around the arm, the leg, or wherever they need it. And that's quite intensive therapy that they would get that changed, sometimes daily, but more often kind of 2 or 3 times a week. And over the you know, a period of, you know, a few weeks or a month or so, then that sort of brings the swelling right down, and then they go onto a compression sleeve. The other one that I haven't actually mentioned on the slide here, but the other one that we do is Kinesio Tapering, which is more often than not kind of associated with sport, yeah, with the athletes and stuff. You'll see them wearing them around the knees and their ankles and their shoulders and stuff. And actually, this stuff has been, I don't know if it's focusing properly. I feel like a little. There you go. And actually, it's kind of been proven to help with lymphedema. When it's applied to the skin, it just sort of opens up those lymphatic channels and helps to keep them open so that the fluid can kind of pass through them. I know you've mentioned as well, actually, Caroline, I know you mentioned earlier about cordon for people for their veins when they've got chemotherapy. And actually, there's a small body of evidence, but a reasonable body, that says that Kinesio Tapering can help with cordon of the veins as well after people have had chemotherapy. So it's really useful. And that tends to be, you would come once a week and have fresh tape put on. So you would have it on for 6 days. We would ask you to take it off the day before you're coming back to see us, so you have a day's break. And then we would reapply it then each week. And it tends to be about a 6-week course, generally speaking. And again, the Kinesio Tapering can be applied anywhere. So we use it on the arm and the breast, but it can be used on literally any part of the body pretty much. So if you've got lymphedema around your groin area, in your legs, in your abdomen, your back, anywhere, the Kinesio Tapering can work. So it's a very, very flexible tool for us to use for the lymphedema. There we go. Where am I? I think that might be it. So obviously, if anyone has any questions, or you know, you want to get in touch with us, both of our numbers are on there, myself and Rachel. Please feel free to phone us, or again phone your specialist nurse, and they can actually, you know, put you in touch with us if you've got any questions about anything.